I'm Whitney. I'm a student nurse. Today I have doctor's orders to do a head to toe assessment on you. Is that okay?
Yes.
Can I have your name and date of birth?
Autumn, January 5th, 2010.
Do you have any allergies?
Nope.
Alrighty, I'll pull the curtain, wash my hands, put on gloves. Alright, so the first thing I'm going to do today is look at your eyes. So I'm looking at your shape of your eyes. Everything looks good, nice and even. So I'm looking at your sclera, nice and white, and your conjunctiva, they're nice and red. That's good. Okay, so I'm going to have you read this sign.
Autumn Churchill.
Okay, good. Alrighty, and now I'm going to have you follow my eyes, down, over, up, down, down. Okay, and I'm going to have you put one hand on one eye. Tell me when you see my hand.
See it? See it? See it? See it?
Okay, and now the other eye.
See it? See it? See it? See it?
Okay, good. So now I'm going to... Good. Good. Alright, and now I'm going to have you look at my fingernail. Okay, and now look at that pink board. Alright, your pupils respond well. That is very good. Okay, and so the next thing I'm going to have you do, I'm going to look at your nose. So your nose looks nice and even, nice and shaped. I'm going to palpate your sinuses, your maxillary, and your frontal. Do you have any pain there?
No.
Okay, I'm going to look up your nose. Everything looks good. I'm looking at your outer lips. They're a little chapped. Can I have you put one hand on your nose? Yep, breathe in. Pate and see. Okay, good. Alrighty, and I'm going to look at your... Can I have you open your mouth? Move your tongue around. Good. Your gums look good. Your teeth look good. Stick your tongue out far. Looking at your tonsils. They look good. Alrighty, and so after that I would do your lymph nodes. So your occipital lymph node, submandibular, submental, postauricular, preauricular, anterior cervical, superficial anterior cervical, posterior cervical, and supraclavicular. Do you have any pain in any of those areas? Alrighty, perfect. And so I did all that. Alright, and can I have you swallow for me? Okay, it moves up and down even. That's good. Alrighty, and I did all that. So now I think I'm going to move on to your ears and hearing. So, do you have any family history of hearing problems? Do you listen to a lot of music?
Yes.
Okay. Do you have any ear infections right now?
No.
Okay, so I am going to inspect your ears. The auricles. Auricles look good. And then pull back on them. Push the tragus in, pin it forward. Feel your mastoid process. Do you have any problems there? Alrighty. And now I would look in your ears with an otoscope. Alright, there's a little bit of wax, but I would be looking at your tympanic membrane. And it would be nice and gray in color since you don't have any ear infections. And so that would be good. And I'm going to do a test. So I'm going to have you turn around this way. Now you just turn that way. Okay, tell me which ear you hear the noise in.
This one. This one. This one. This one.
Alright, good job. That's the whisper test. So now you can turn back around. And now I'm going to be moving on to your skin. So the first thing I'm going to do is look at your color of your skin. Nice and pink. There's no bruises, no redness, no rashes it looks like. Alrighty, and then after that I would do your skin turgor. So that would show me if you're dehydrated. Okay, you have good skin turgor. And I'm going to do capillary refill. Less than 3 seconds. And can I see your feet? Okay, they're all less than 3 seconds. That's good. Now I'm going to look at your nail and assess the shape. So your nail bed looks good. the shape of your nails is nice and round. They're nice and smooth. Your capillary refill is less than 3 seconds. They're nice and pink. It doesn't look like there's any bruising on any of them. Alright, so that is good. And now I would do, I'm going to look at your legs for edema. Maybe you can just set them there. I don't know if the camera can get them. Okay, you have no edema at all, but if you did have edema, like level 1, it would be 2 inches. Level 2, it would be 4 inches. Level 3, 6 inches. And level 4, 8 inches. And can I look at your peripheral veins here? Alright, they look good. I'm looking for signs of phlebitis. That would be red and swelling. I don't see any signs of phlebitis. Alright, so that's good. And now I would do, alright, so now I think I would do, can I have you hold your hands out straight? I'm looking for tremors. I don't see any tremors at all, so that's good. Alrighty, and then after that, okay, so I think I'm going to palpate your joints right now. Do you have any swelling, pain? I'll do your knee joints. Any swelling or pain in any of those? Ankles, any swelling or pain? Nope. Okay, good. So now I'm going to be testing your muscles. So, for your sternocleidomastoid, push your head against my hand. Good. Good. Trapezius, for your traps. Shrug your shoulders. Now I'm push down. Good. Hold your arms out like this. Press up. Good. Now press down. That'd be your biceps and triceps. And for your legs, this will be hard to do. Try if you push your legs out towards my hand. Push them out. Okay. Now press them in. That would be your hamstrings and your quadriceps. Okay, could I have you do the grip test? Squeeze my fingers. Alright, good. And now for hip abduction, I'll just have you put your legs like this. Move your leg out that way. Good. And the same thing over here. Good. And push them in. Good. Alright, that's hip abduction and adduction. Okay, and for your ankles and feet, I'll do the same thing. Move your feet up. Okay, press your feet down. Good. And for your wrists and your hands, push up. And your hands. Move your hands up too. There you go. Push down. Alright, that's good. And also your deltoid I would test too. Your deltoid would be tested too when I did your biceps and triceps, so that's all good. Okay, and so now I'm going to, I don't think the camera will reach over here, so now I'm going to have you just turn around for me. And I'm going to assess for, I would have you normally walk, but we're tight on space here. Move your back over. Okay, I'm assessing for signs of kyphosis, lordosis, or scoliosis. Scoliosis would be curvature of the spine and the S. Kyphosis would be hunchback, and lordosis would be where you lean way back. Okay, so those are all good. Alrighty. And could I just have you stand up on your bed and walk? I don't know if it'll get it, but... Okay, good. Your stride and gait is good, very even, that's all good. So for your neurological assessment, I just had you walk your level of consciousness and memory. I'm going to have you remember 2 words, okay? 1 horse and 1 unicorn.
Cat.
Okay, you remember those 2 words because I'll ask them when I'm done with this section. Alright, so... I'm going to do your Babinski reflex now. So I'm going to take your foot. Okay, good. If I would have did that and all your toes would have went like this, you'd have a lot of troubles. There'd be a lot of problems. Alright, and I'm going to have you do your finger... Should I do finger to nose? Okay. Put your finger to your nose and then match it with my hand. this finger. Just one hand. Touch your nose and then touch my hand. Okay? Touch your nose and then touch my hand. Touch your nose and then touch my hand. Touch your nose and then touch my hand. Okay, good. Alrighty, so we did all those, and now I'm going to ask you, do you remember those 2 words?
Mm-hmm.
Okay, can you tell me them?
One horse, one unicorn.
Okay, good. And now I'm going to get my cranial nerves and get a piece of paper, and I'm going to write down my cranial nerves so I can remember what they were, because I'm going to do those next, okay?
Mm-hmm.
Remember what I do with each and every one of them. Okay, so I got them. So, okay, for testing your olfactory, we would have you smell. So, you smell Vaseline?
Yes.
Okay. For optic, I had you read that sign. That's perfect. Ocular motor was your movement of your eyes, up and down, over and over. Okay. Trochlear was the downward movement of your eye, so have you look down. Okay, good. Trigeminal was, alright, so tell me, close your eyes. Do you feel that?
Yeah.
Okay. Perfect, that's your trigeminal. Adducens was the movement of your eyes, which you already did. Facial, can I have you smile? Okay, good. Auditory, that was the whisper test where your hearing, where I could put things up in your ears. The vagus nerve, can I have you stick out your tongue and say ah? Okay, that's good. For your accessory nerve, that was you shrugging your shoulder, pushed up on your shoulders. Okay, that was that one. And hypoglossal is tongue movement. Can you move your tongue? Okay, perfect. Alrighty, so we got those out of the way. And so now we're on to the respiratory assessment. So now I'm going to ask you 3 questions. Do you have any breathing problems?
Mm-mm.
Do you have asthma?
No.
Do you use inhalers?
No.
Okay, so I'm going to inspect your thorax. Okay, so everything looks good. And on your back, everything looks good. What was I gonna say? Okay, so I'm gonna have you turn around so I can listen to the back of your lungs, if that's okay. Everything's lateral. We already did the kyphosis, lordosis, and scoliosis, so I'm not worried about that. You don't have any of those. It doesn't look like it takes you any effort to breathe. It doesn't look like you're struggling for breathing at all. Okay, so now I'm going to, I believe, yes, listen, I'm going to palpate your back. Okay, can you say 99?
99.
Say it again.
99.
Again.
99. 99. 99.
And I would use that, like, if you had pneumonia, I could tell by the rattling when I did that. Now I'm going to listen to your breathing. Okay, take a deep breath in. Again. Again. Alright, your lungs sound clear, that's good. So now I'm going to have you sit down, or lay back down so I can do your anterior chest. Okay, and I'm going to listen to your trachea while I'm at it. Okay, can I have you breathe? Good. Okay, so now I'm going to inspect and palpate your anterior chest. I don't see any pulsations, which is good. Okay, so now I'm going to listen to your anterior chest. breathe in. Okay, good. Your chest was all clear, and so now, good. Okay, and now I'm going to, I believe that was all for the chest. I did the pneumonia. I listened. I believe that was all for the front too, because I listened. Okay, so now I'm going to ask you some problems for your heart. Do you have any family history of heart problems?
No.
Does your heart beat fast when you run?
No. Yeah.
Yeah. Do you have any heart troubles at all?
No.
Alrighty, perfect. So now I'm going to have you lay straight down, and I would be assessing for jugular vein distension. You don't have any. If you did, I would reassess and I would move you up 45 degrees. I'm going to inspect your chest. Okay, so now I'm going to inspect your chest. I don't see any pulsation, so that's good. Now I'm going to palpate your chest. Do you have any pain in any of those areas?
Mm.
Okay, good. Now I'm going to listen to your carotids with the bell side of my stethoscope. Good. Good. Now I'm going to listen to your heart valves. Your S2 sounds are going to be up here, and your S1 sounds are going to be down there. Okay, so aortic. Good. Pulmonic. Herb's point. A2. Tricuspid. And your mitral. Okay, and all of those sound normal, so that's good. Alrighty, so now I would do your peripheral pulses, and, okay, so temporal, carotid, brachial, radial, obviously your aortic, your femoral, your popliteal, posterior tibial, and dorsal pedis. Okay, so those are all good. Perfect. Alrighty, and then I would, what would I do? Your last assessment, so abdominal. So I'm going to inspect your abdomen, and I have your knees slightly bent up. Okay, so I'm going to inspect your abdomen. Okay, everything looks good. There's no, like, bounding pulsations or anything. I'm going to listen. All 4 quadrants, make sure your bowel sounds are active. Yep. 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 Okay, good. So keep your shirt up. I'm going to listen on the bell side to your, oh gosh, what are they called? I know what they're called. I can't even think of it. Yeah, arteries. Yeah. Listen to your arteries. Left and right renal. Left and right iliac. And your femoral artery, obviously. Okay, and now I'm going to palpate or percuss. I'm going to palpate, and I would go 1 to 3 inches deep. And if a person was ticklish, you would just keep doing it, but you would do it maybe not so deep. Do you have any pain in any of those areas?
No.
All right, perfect. And I would assess the abdomen from the side, obviously, and I would see, that's what I forgot to do at the beginning, make sure everything's nice and even, I don't see any pulsations, and everything is even. Okay, perfect. So is there anything else I could do for you? I have time.
No.
All right, thank you very much.